who again is so graciously joined me live in the studio, and I appreciate it. Of course, these guys they're here all the time, so they're nobody new. But no, then again, I take that back. I love them. Yeah, I really appreciate their support. Yeah, except that guy. But now it's time to talk about something serious that is very important, and I hope everybody, again, it's important whether you listen live or archive, because these shows are recorded. You can go back and listen to them right here on Mixlr.com/WHTP Radio Network, Mixlr.com, Mixlr.com/WHTP Radio Network. We have to find out, what do we do? I mean, of course, you want to stay healthy, but it costs to stay healthy. And versus you paying out of pocket for everything, it's better to go and get some health insurance so that somebody else pay for it. Should I say somebody else pay for it?
So the idea of health insurance is, or like any
insurance. Hold on, because you about to go right into it. Well, I tell you what, let me get the introduction out, because I see that's what I get for trying to preface the conversation. But yeah, I am joined live in the studio, and I don't even have my claps. Hold on, I should do. Yes, I do. Let me see something. No, not that clap. No, not the snow clap. I'm honestly.
So what are you telling me? My clap is not that good.
Look, help me welcome, because I'm you gonna have me talking longer, and I only have so much long for this interview, so much time for this interview. I would like to again welcome into the studio from the Cuyahoga Health Access Partnership, live in the studio here, Ms. Rachel DeGolio.
Thank you, Mr. Yancey. I'm very glad to be here.
Oh, yeah, there you go. Also, yeah, you didn't get to hear it right, because I did turn it up. Yeah, there we go. Oh,
you should have said his name wrong a couple times.
No, don't say his name wrong. Wow. Really? Okay, moving on. First of all, because I was trying to decide how I want to kind of tailor the conversation. Do I want to talk about CHAP first, or do we go straight into the insurance? Let's talk about CHAP first. We talk about Cuyahoga Health Access Partnership. When was that started?
I think it's about 4 or 5 years old now, and really what it is a collaboration of a whole lot of the healthcare institutions in Cuyahoga County. Mm-hmm. So the hospitals, the free clinic, the community health centers. And the idea of CHAP in the beginning was, how can they work together? How can all these big health providing institutions work together to make sure that more people in Cuyahoga County get the coverage they need and get health care that they need?
Right.
So before the Affordable Care Act was passed, CHAP developed something called the Access Plan, which helped uninsured people get access to primary care, and if they needed it, specialty care at no charge. Then the Affordable Care Act came along. It was passed in 2010, and it started being rolled out every year. Mm-hmm. And last year, for the first time, we had the Medicaid expansion and the healthcare marketplace for people to buy private insurance. So for the first time, hundreds of thousands of Ohioans could get access to health care that they couldn't before, health insurance that they couldn't before.
Okay.
So what CHAP did was hire 6 were called ACA Enrollment Navigators. ACA stands for Affordable Care Act. That's the name of the bill.
Right.
Which a lot of people don't know what that is. So the nickname is Obamacare.
Which I don't like.
I know you don't like that, because originally that term was coined by the people who didn't like the law. However, about a year after that, President Obama said, hey, Obamacares, it's okay, we can call it Obamacare. So a lot of people referred to it that way. At any rate, CHAP has 6 navigators, and I'm one of them. Mm-hmm. And we're navigators because we help people figure out how to navigate the applications to get the health insurance they're entitled to. Right. And we're all headquartered in different healthcare centers around the county. Mm-hmm. So, for example, my office is at St. Vincent Charity Hospital at their healthcare center.
Okay. Now, and again, when you say the application, now I'm assuming you're talking about on the website?
Well, so you apply online, but you can also apply by phone, and I can share the 800 numbers.
Okay.
But maybe I should explain what the two main ways are that people can
Right,
get coverage now.
Right, because most people are more accustomed to hearing the healthcare.gov. You know, they hear that they have commercials all over the places, all over TV, and so they're thinking that that's the only way that they can get access. Which again, you don't want people not to, sign up because I don't have a computer or I can't get to the library. So you're saying that people actually can call and get access.
Yes, indeed. So here's the basic thing. Your income, or lack thereof, if you don't make any money, your income will determine whether or not you're eligible for Medicaid, which is health insurance that's public, and it's a partnership of our state and the federal government. And the Affordable Care Act made it available, gave the state a lot more money to get a lot more people signed up to much higher levels of income. So whether you're eligible for Medicaid, or if you're over a certain level, which is 138% of the federal poverty level, and I'll give some examples of those numbers, then you go to healthcare.gov. And that's what people call the marketplace.
Right.
And it's like an online marketplace, and you can shop for health insurance there after you fill out the application.
Right.
So those are the two ways. So let me just give people an idea. If you are a single person and you don't have any dependents, if you make less money in a year than $16,104, which comes out to $1,342 a month, you are eligible probably for Medicaid.
Okay.
If you make more than that, that's the cutoff for single. For couple, it's $21,707.
Right.
So that gives people an idea. There's a lot of people that fall in that category.
Right. Now, and one thing, because most people, when they hear that, they kind of shy away from it because they think of it, that's welfare, so to speak. That you don't consider that welfare, though.
Medicaid is something we've all paid for. Though, when we're working and we're paying our payroll taxes, we're paying for it. And the idea is that people need health insurance in order to get the health care they need.
Right.
And I can tell you, for example, St. Vincent Charity Hospital has given out a lot of charity care, free care for years. This law is helping them meet their bottom line and expand the care that they can give because they're being reimbursed by the Medicaid program for a lot more people than they used to. It creates jobs. It helps people get back on their feet when they're in between jobs. Because if you're sick, how can you go out and get a job and contribute to society?
Right.
And it's especially important, for in the past, mothers and young children were mainly the ones eligible.
Right.
Now, we're talking about any adult. And now we're talking about the under 65 set. We're not talking about Medicare.
Right.
Okay, under 65 years old. But there are a lot of seniors eligible for Medicaid, too, if they have very low income.
Wow.
So it's you know what? The way I look on it, it's an investment in our people that we make this program available because there's an awful lot of people that can't afford to go out and buy private insurance in the marketplace. Now, if you do have a decent job and you make more money than that threshold I mentioned, $16,000 for an individual, you can go to the marketplace, and depending on your income again, what the Affordable Care Act does, aka Obamacare, what the Affordable Care Act does, it provides subsidies to help pay your monthly premium, which is like your membership, right? And also subsidies for other out-of-pocket costs. So it makes private health insurance a whole lot more affordable for a lot of people, too.
Right. You had a question?
Yeah, I got a question. Now, when you said for two people, is that combined income?
Yeah,
or
combined income.
In one household?
In one house. You have to be on the same tax form, basically.
Whether they even if they're not officially married.
Well, let's see here. I think how households are defined is a little complicated in the tax code. For the marketplace, you got to be on the same tax form. So if you're married, you're filing jointly. If you have kids, you've got all your kids on it. People can have a dependent who doesn't live with them, say a child who lives with another parent, and that can still qualify.
Okay.
But it's not like any two people can get together and say, hey, we're a family, so this counts for us, There are some specific requirements in the tax code.
Right, and now I say that's. I'm glad you asked that because some people will do that and then they'll wonder why all of a sudden their health care get dropped. Because I mean, like you said, when you come down to applications and fill out the applications, you don't. Some people they'll just go and fill out the applications like, oh, okay, this is fine, and they think it's cool, or they know what they're doing. Eventually, the law is going to catch up to you. So I mean, again, true enough, this law has been put in place for you to gain or have access to health care. Don't take it. I mean, don't misuse it. In other words, I'm glad you asked that question. But again, I really wanted to. My biggest reason for asking that question in regards to Medicaid, like I said, true enough, we want to get them people. We want people to, if they're above that line, like you said, to get to sign up for the Affordable Care Act. But if you are not even if you're not making a certain amount of money, don't think for a minute, oh well, I'm signing up for welfare. That's not welfare. That's just health care. Which again is basically that's available for anybody. You just have to go and sign up for it. Now, just again, you have some more numbers on what.
Well, so let me just so if people want to go on the web and look at these two options for getting health insurance, for getting coverage, you can go at the website everyone's heard about, www.healthcare.gov, Gov. You can go there, and there's a button on the left on the home page. It says, See Plans Before I Apply. You can click on that. They'll ask you your age, how many in your family, and what your income is, and then it can give you an estimate for what kind of subsidy you might get to help pay your premiums. And then it'll say, do you want to see the plans? You can click yes, and it'll show you all the plans available in your county. And that's true no matter what state you live in the country, by the way. It doesn't just have to be Ohio. I know we're broadcasting from Ohio here, but you have listeners all over the country.
Right.
You can go to healthcare.gov, click on See Plans Before I Apply, and browse. And you can look and see how much, what the plans are, what they offer, what kind of subsidy you might get, and get a sense of what you might like to apply for once you actually fill out an application. So that's a real important thing.
Right. Now, but again, that's for the Affordable Care Act.
Right.
But for Medicaid, you don't have to go. You go to the same website for that as well.
Now that varies state by state.
Okay.
So right now I'm going to talk to the people in Ohio, okay?
Okay.
In Ohio, we have a website that's www.benefits.ohio.gov, Gov. That's benefits.ohio.gov. This is a new website as of last year, which is consolidating all the public programs. You go to that website now to apply for Medicaid, for food assistance, cash assistance, unemployment insurance, WIC, energy assistance. So they're consolidating. They're still getting it up and running and bringing it all together into one big database. But that's where people go to apply. And there are you can find out more about what Medicaid covers there, and I'll be glad to talk about that in a minute.
Yes, ma'am.
Anybody in any state in the country, you probably have a different website. So if you just Google, Pennsylvania Medicaid or Colorado Medicaid, you can find out what goes on with Medicaid in your state. And here's a very significant thing. It was a big political battle about expanding the number of people eligible for Medicaid. And so only about half the states have decided to do it. You may remember that a couple of years ago there was a big Supreme Court decision challenging the Affordable Care Act and claiming it was not constitutional. And the Supreme Court upheld it. But the one thing they did was they said this Medicaid expansion piece was optional for states. So what happened is, I think it's about 26 states have chosen to do it. And the people in the other states are really suffering because there's a lot of people that aren't eligible for Medicaid that would have been otherwise, and the federal government would have paid the whole big difference for their state. But for political reasons in these other states, particularly states in the South, it's been really tough. But Ohio, fortunately, our governor really did go to bat to expand Medicaid, and the legislature, he did it by going around the legislature through the control board. So that's actually going to be up for debate again this year. Hopefully, it'll stay in place.
I got a question.
Sure.
Are you familiar with Denzel Washington movie John Q?
Yes.
So you see the
When
end,
he came into the emergency room.
right?
Right.
But did you see the ending credits?
No, remind me. It's been a while.
Well, that's a true story. And
Then you might explain the story to people who don't know about that movie.
Real quick, John Q, which was a character played by Denzel Washington, was a man who worked at his job for over 20 years. And because he went to part-time hours and company policy change, he wasn't eligible for the health insurance he had paid into. They take out his check.
Wow.
Yeah.
And
all
after
those
20 years,
After
he
how
had
long?
They dropped
22
him.
years. He paid all that money, come out his check every week, and he couldn't. His son had enlarged heart,
A young boy.
a 12-year-old boy,
Right.
and he needed a heart transplant, which was covered under his insurance when he was a full-time worker.
Mm-hmm.
So he had zilch, no coverage after he paid into it at 22 years. So he ended up he was desperate, and his wife was pressing him because his son was going to die, and it cost $100,000 just to get on the waiting list, cash out the pocket, and so the surgery was $400,000.
Well, you remember these numbers.
Right.
And this is a numbers
It's been a
guy.
few years since I saw that movie.
So he took the emergency room hostage. James Wood played a heart surgeon, and
That's right.
once the people in the emergency room, which was technically hostages at first, once they learned his story while he's doing this, they pretty much was trying to help him. And so anyway, at the end of the movie, everything ended up working out fine. They showed the critics that this law was passed first in Ohio about people who was denied health care if they came into the emergency room without insurance. They started it here first, which is I'm quite sure
That they can't turn them away.
Right. And now I got a question now. Why Metro pretty much only qualify for that versus the other hospitals? Is that for
Oh, no. All the hospitals take Medicaid.
right? I mean, but Metro would take you one time without nothing,
Okay.
and
well,
after
so,
that they suggest the prorate program. for
Right.
you.
So the special thing about Metro is it gets public monies. It's really our public hospital system.
Okay.
It also takes a lot of privately insured patients too. But Metro is unique that way. We are very fortunate that we have
Right.
Metro.
Because if you don't have no insurance, you go to Cleveland Clinic or University Mercy. They tell you right there at the administration desk, they send you to Metro.
Well, sometimes that happens, but they all do charity care, and they all take Medicaid one way or the other. What we tell people is you want to make sure that when you sign up for Medicaid, you get a chance. You can sign up for. There's 5 plans if you live in our county. Every county has their own managed care plans in Ohio, and this may be different in other states. But in Ohio, you have to sign up for a managed care plan if you've got Medicaid. You want to make sure you choose a plan that your doctor takes. And not all the hospitals take all 5 plans. So you want to make sure you sign up for a plan that the hospital you want to go to takes. It gets complicated for people. That's why it's helpful to have people like us who are navigators to help them.
Right.
And I would like to share one other number.
Go ahead.
Which is, and this is national really, 211. You know about that?
Everybody
Yeah.
knows that. It's
All right.
supposed to know about that
you
number.
call 211, first call for help, anywhere in the country. And if you want to find a navigator or an assister, someone who can help you sign up for the health insurance you're eligible for, they can tell you. Wherever you are.
I just want to say one thing about Metro. What people don't know is that they have what's called a prorate program.
Sliding scale.
That's what it's called. And you can have previous insurance through your employer, but I think the limited for that is $32,000 for annual income.
Yeah, I don't know about that level of detail, but I do know
Yeah.
they have a sliding scale for people.
Right.
They rate you. You meet with their financial counselor, and they
Right.
look at your income and what you can afford. Yeah.
And the lowest copay, the highest copay for even surgeries, only go up to $25. So it's the sliding scale start $5 copay, depending on what you've
Not the
been seeing for.
situation.
So 5, 10, 50, 20, up to 25 for the most expensive services. Yep.
Some of them, they don't pay nothing at all.
Right.
Yeah, if your income's low enough, you won't have to pay anything, and that's true.
Like if you work for probably the city or the county or something like that, like certain hospitals, you don't have to pay nothing.
Right. Well, I'll tell you what, real quick, because I want to, and
we have a deadline to talk about.
Well, we want to talk about the deadline. We also want to talk about the tax penalty. We're going to talk about that stuff when we come out from commercial break. But one thing I want to stress, not only before we go to commercial break, and even before we end the interview, how important is it for people to sign up for this? Because I have some colleagues that are in healthcare, dentists, general practitioners, and exactly why. I mean, how does this benefit the health industry?
Providers? Right,
healthcare providers.
Like my example with St. Vincent Charity, they get paid for the services that in the past they might have given free of charge, or been paid a lot less.
Right.
This law, especially the Medicaid expansion, is really helping generate more jobs and more income for the healthcare sector. That's our biggest industry in Cleveland, is healthcare, right?
Yeah.
Yeah. So it's been a really big deal, and we have there's money in the Affordable Care Act to train more doctors.
Right.
We need that, particularly primary care doctors. We have a lot of specialists. We need more primary care. And there's money for that. There's been a lot more money for these federally qualified community health centers, like Neighborhood Family Practice and the Free Clinic and Neon and some of these others.
Right.
They have more funding, so they're expanding. And they're out there in the community, right there where people need them.
Right. And again, it's better than you going there, having to go to the emergency room, because I ain't gonna lie, I've been there before. Go to the emergency room.
That is not the way to get health care.
Go to hold on. This is the bad part. You go there, they take care of you, and they see you all. Oh, I'm glad you feel better. I hope you feel better. And then a couple of weeks later, you get this letter in the mail that says you owe $300. $300 for what?
It's $800 to $1,000 for a sit in the emergency room.
Right.
To take your name, number, and email.
Right.
So part of what they're trying to do is get people trained to go to the doctor, make appointments, and go get your checkups. Or if you're starting to feel sick, go to urgent care. Don't wait till you're so sick you have to go to the emergency room.
Right. And then end up with a bill later that you can't pay for. But if you had signed up for health care, either through Cuyahoga Health Access, of course, got to plug that.
And for the record, medical bills is the number one reason why people file bankruptcy.
That's absolutely right.
Wow.
Can I share CHAP's 800 number?
Well, yeah, you can share it now, and then of course you can share it again.
Okay. It's 888-929-CHAP, which is 2427. 888-929-2427. If you live in Cuyahoga County or one of our neighboring counties, you can call that number, and we'll hook you up with a navigator to help you find out what you're eligible for health insurance.
But just ask for Rachel. Tell her you heard it on the Who Has a Power Radio Network. But I tell you what, we're going to go to a commercial. Yeah, let's go to a commercial break. When we come back, we're going to talk more about this. We're going to talk more about the Affordable Care Act. Exactly the deadlines, because there are deadlines that most people don't realize. They think, I should be able to sign up for this all year round, when unfortunately that's not the case. There are certain times where you can sign up for it, and that's also a time, even when you sign up for it, there's a certain amount of time when it actually kicks in. And again, we got to find out about that. Like, hold on, so if I sign up for it now, I can't use it until. We'll talk about that and tax penalty and more. Look, again, we're live here with Rachel DeGolio, who is again from Cuyahoga Health Access Partnership. Got Mikael Newbay in the studio and Don Blake Jr. We'll be right back after this commercial break, so stay tuned.
It's funny you mentioned John Q. It's been a while since people cheered in the theaters for him.
Oh yeah.
Did you ever sit in the theater and watch that?
Yeah.
Yeah. That was back when people were so mad about managed care.
Yeah.
Yeah.
That's that's a tear-jerking movie, especially if you're a parent.
Yeah. Oh yeah.
Yeah.
Oh, who was the woman that played that?
Oh, his wife.
The cold-hearted
Oh,
hospital
yeah,
executive.
yeah. She
The
played a couple
blonde.
other movies. I can't remember her name, but
Anne.
I know you're talking
Yeah.
about. Right. Yeah, well, I used to work in sales and leasing. I used to work in sales and leasing at Ford. And I'm telling you, every time medical bill, that's why people got bankruptcy.
That's
It's
true.
not foreclosure on the house. It's not repo on the cars.
That's right.
It's medical bill. You see the bar graph with all those put together, they don't even come up halfway.
Yeah, I know. It's true.
So
It's true.
People don't
Well,
live
we
it.
have no cost controls in our system. And they don't quite have a handle on that yet, even with the Affordable Care Act. We still got a ways to go, but unfortunately, with this Congress, we can't do
So
much more.
you call it welfare whatever you want. You get them bills you want to.
Right.
But I'm telling you, $800. They charged me $800, even though I didn't have to pay it.
And what about the ambulance that took you there?
I didn't go to right.
Well, see, that would be another one.
That's $600 just to ride.
Yeah.
But I had to pay like darn near what, 300?
For what?
No, for the ride to get there. Remember when I sprained my knee?
No, I don't remember you taking no ambulance.
They had me in the waiting room for a good minute.
That's
They
ridiculous.
had me on the wheelchair because I couldn't stand on it.
My X-ray was only $66. My boot for my foot was on $188, but you charged me $800 to sit.
Yeah. Well, the
Just to be
emergency
seen.
rooms are the most expensive way to provide care. That's the problem. But the way hospitals charge for things, there's
That's
no rhyme or
ridiculous.
reason to it.
That's ridiculous. Just to sit on the waiting list to be seen.
Yeah. If you can avoid the emergency room, it's a good thing. Are we back? No? Not yet.
Oh, no, we might wreck it.
What else do you want to talk about? You'll tell me. We should tell them about what Medicaid covers and how
Right.
comprehensive it
Oh,
is.
yeah.
And I'll tell them about the deadline and the
Everything.
tax penalties.
Yeah.
Everything.
Right.
Yeah.
I mean,
Okay.
I say, thing is, feel free, because I don't cut people off, mind you. That's why you have an hour. Like, mind you, we have questions, but the biggest thing is the information that gets out so people understand how, like I said, now I really want to stress how important it is. That's why when we come back, we'll talk about the deadlines for people.
Do you have
to
any
sign
idea
up.
how many people listen?
It all depends. Yeah, well, not.
They're going to ask me in my log I fill out how many people heard your radio show. So I got to
Oh,
put
okay.
a number in. You can tell me what to put.
Okay.
get rid of cities too.
Oh, yeah. Well, they asked me just numbers,
Yeah,
actually.
we ready to come back.
But okay.
But you know what? You can't just go by that.
Hmm?
Oh, I tell you.
And we are back. And we are live in the studio with Rachel. I'm about to say Rachel. Who is Rachel? Rachel DeGolio, who is a navigator, a ACA navigator or Affordable Care Act navigator with the Cuyahoga Health Access Partnership, or CHAP for short. And even I ain't gonna lie to you, it was so cool because when I met her over at the American Heart Association / American Stroke Association with Brenda Parks, we had a what was that?
Was
A
it
kickoff?
workshop?
Yeah, it was a workshop, and we went downstairs after the workshop was over, and it was Rachel and one of her
Sandra.
co-workers, Sandra, was there, and it's really all about promotions and using certain things to promote yourself. Guess what they gave away to promote CHAP?
Chapstick.
Right. Somebody's like,
With
hold
our
on.
phone number on it.
Oh,
Right.
Oh, that's right.
Right, but the chapstick like, hold on. Did you try to take my lips and scratch or something? What you trying to say? No, I'm messing. Reggie's like, no, that is not what we were trying to say. But if it's going to help you, then yes, no. I thought it was very unique that that was the approach that they took. And yes, matter of fact, hold on, where's it at?
Do you have it?
Yeah, I want to see what it look like.
There it is.
Yes.
Oh, wow.
Let me see
Wow.
that.
Yes, it's called. It says CHAP on there. So if your lips are chapped and you need health care, then you need to pull out your chapstick because the phone number and everything is on there. The information is on there.
Wow.
Oh man, talk about some promotion. That is great marketing right
That
there.
sure is.
Yeah.
But yeah. Now we again, for those who are just tuning in, we have been talking about again the first of all we talked about Medicaid because if you fall below a certain income level, you don't have to go to you don't have to sign up for the Affordable Care Act. You can just go to what's the name of the website again?
It's benefits.ohio.gov.
Right, that's if you're here in Ohio, but then also you mentioned 211. People can call as well if they need more information. 211 is not just for Ohio.
Nope.
That's crossing right. So if you have any questions in regards to health care or whether you have to sign up for Medicaid or the Affordable Care Act, just call 211. Now, for those who are above a certain income level that does have to sign up for the Affordable Care Act. That's what we've been talking about now. But something that's very important that most people don't know is, that you cannot sign up for the Affordable Care Act year round. And so there deadlines. And Rachel, you said you know you have information about the deadlines. When can people actually sign up for the Affordable Care Act?
Well, we're in open enrollment right now.
Okay.
So private insurance always has only a limited time you can sign up. And they call that open enrollment.
Mm-hmm.
It started this year, December 15th. No, November 15th. No, December 15th this year. And it's going till February 15th.
Okay.
Okay. So the way it works is if you sign up by the 15th of the month, so this week, that would be this Thursday, if you have paid your first premium for your plan by January 15th, your new plan will start for you February 1.
Okay.
If you miss that, then you need to sign up by February 15th in order for your plan to start March 1st. Now, if you miss those deadlines, you may not be able to sign up for insurance on the healthcare.gov again until open enrollment next time around, and we're not sure when that'll be, but at the end of the year. However, if you have a life change, say you get married, you have a baby, you lose a job, you get a job, you start making more money, any number of things that might affect your eligibility, we can go in there to your application. We can apply for you with a special enrollment period. And so we do that with people all year round. That's important for people to know. Now, Medicaid has no deadline. A lot of people think that deadline applies to Medicaid. It does not. There's no deadline. You can apply for Medicaid all year long. That's very important.
Right. I'm going to say, again, go back and stress it again when you mentioned that anytime your eligibility change, and this is important because, again, you don't want to get to the emergency room or get to the doctor's office and they say your insurance is invalid. They say, well, how is it invalid? And I mean, I've had it all this time, but then like you said, you had some type of especially, and I think this is probably be the biggest issue or biggest reason why people will get there and won't have access is because they have gotten a new job and they have an increase in income. It's like, okay, they're thinking that, okay, well, my insurance should still be valid prior to me getting that job. Is that something?
Well, a lot of people still get insurance from their job. Maybe half the people. It's a lot less than it used to be, but it's maybe around half.
Right, but I'm saying like for those who may have Medicare, like you said, those who have gone above that.
Because their income changed. Right. That's right. If your income if you get a job and you're making more money, and all of a sudden you're making more money than is eligible for Medicaid, you will get dropped. You're supposed to report an income change to Medicaid, but they'll find out. They'll find out if you don't. And you'll get dropped, and then you would qualify at that point for a special enrollment period on the marketplace to get private insurance. But you will have to sign up, and you'll have to pay a premium, which is an amount every month.
Right, and I said now, it was just important to mention that because some people would think, oh well, it doesn't matter, my insurance should still go, I guess, until the next read the term period. And possibly that's not going to be the case. Like I said, you'll go to the doctor, you'll go to the emergency room, and you think, oh, we got health care. Hold on. Didn't I just get a job? Oh, that shouldn't be a big deal. But then you
got to make sure you pay that premium every month because you can get dropped if you don't.
Right.
And if you get late, you need to make sure you're cool with the insurance company that they don't drop you.
Mm-hmm.
What we're doing right now for people who have been on the went on the marketplace and got health insurance a year ago is we're helping them get signed up again. Because sometimes you need to change plans to get a better deal. Sometimes the premium's gone up more than you would like, so you want to shop for another plan. I'll tell you this, there are almost 3 times as many plans on the marketplace this year as there were last in Ohio.
Wow.
And actually, I think it's too many because it gets confusing for people.
Right.
But there are 102 plans on the marketplace right now in Ohio, in Cuyahoga County. That's more than I think a lot of places. So we help people sort through that and figure out what makes sense for them. There's 4 different levels of plans on the marketplace.
Right, that's important to mention.
And they're by the precious metals. There's bronze, silver, gold, and platinum. So we encourage people to try to at least buy a silver plan because it's better coverage. The premiums are going to be a little higher. So here's the way it works. The lower your premium, that's the amount you pay every month, the more you're going to have to pay out of pocket otherwise. Big deductibles or co-insurance or co-pays when you actually get health services. So the bronze plans on average cover 60% of your costs. The silver plans will cover 70%. So we encourage folks to try and at least sign up for silver, and that's where you get the most help with your cost sharing, because there's 2 ways that people can get financial help when they buy insurance on the marketplace. One is a premium tax credit this is funneled through the tax system, and we can talk about that in a minute. But it's basically money every month from the government to help pay your premiums so you don't have to pay so much. The other way is cost sharing, and that reduces the amount of your deductible and reduces the amount of out-of-pocket maximum for the year for you.
I got a question.
Sure.
Me being a holistic health practitioner, I have helped people bring their health up to par because their job gave them a mandatory deadline. If they don't meet certain numbers, their premium gonna go up.
Oh, you mean like their weight and things like that?
Yeah.
Oh, yeah.
So do this program offer certain incentives if you have a certain health level?
I don't think so.
Okay.
But however, if you smoke, that is the only question they will ask. Do you use tobacco?
Oh, yeah.
They are allowed, the plans can charge as much as 50% more.
Ooh, yeah.
Wow. Did you hold? Whoa. Stop. You don't
That
just,
is not,
I'm about to say, don't
that's nothing
just,
new. That's
you
nothing
smoke.
new, by the way.
That's
Don't
not.
think the Affordable Care Act invented that.
No.
right. Well, I'm just saying, just so people, I mean, how
But
you
here's
say,
the other side. You quit smoking during the year, you can go in and get a bigger subsidy, then you can get it lowered, okay?
you say if you stop smoking.
Right.
Okay. So, and again, see, like I said, you can't, how you know something? You can't just mention certain numbers and just fly past it like, oh, you
No,
this.
that's a biggie.
Yeah, I'm about to say, you just said, and most people, and again, this is important. I hope that anybody's listening to this broadcast, again, whether it be live or archive, if you are a smoker, if you notice somebody that smokes, and they don't have insurance, and again, they are over that they're above the eligibility for Medicaid, then you need to understand how important it is not to smoke. Because you just said she said it again, 50%, they could charge you up to 50% more
For your
premiums. Again, this is health insurance. Now, this is not life insurance, this is health insurance.
Well, life insurance might do the same thing,
Yeah,
but that's
yeah.
another matter.
Right, but now, again, because you just said
Okay, so
something else. Well, something else that you mentioned that was important because you said it's 50%, up to 50% more than premium. But if they quit smoking during, I guess, was it during the eligibility period?
Well,
or?
during the year. And you can report that, and you can get your premium reduced.
But how long? Because see, now that's the question. How
Well-
long would you have to stop smoking?
Well, I think you have to work it through with your doctor so that you can certify that it's actually happened. But I know it's available. I haven't actually personally had to help someone walk through that yet, so I
Okay.
don't really know how it works.
Okay.
But here's the thing: there are some things, some protections for people that the Affordable Care Act put in place, and
Right.
a really big one. And I think a lot of people have forgotten this. Remember pre-existing conditions?
Right.
That's illegal now.
Yes, it is. And
They cannot deny anybody insurance, the insurance companies, whether they're inside the marketplace or outside that you're buying it,
that's why they don't.
for
like
any
Obama.
pre-existing health condition. That is illegal. Another one, women can no longer be charged more than men. Women were charged routinely 150% of what men were charged, like 50% more than men for the same policy. Because, by the way, we have babies. Oh, is that unusual, huh? So, that is illegal now, too. Previously, older people could be charged as much as 7 times more than young people. The Affordable Care Act reduced that differential. It can be no more than 3 times as much now. We know older people use more health care than younger people by definition. So it's not perfect, but